Now coming to another important problem. You saw fluid accumulating in the pericardial cavity. What happens if the pericardium is fibrosed and restricted and your heart chamber is not able to enlarge? It is a constrictive pericarditis. It is said to be present when the diastolic filling of the heart is restricted by a thickened and hardened pericardium, which prevents the expansion of the heart chamber. The visceral and the parietal pericardial layer become hardened as a result of fibrosis and calcification. The space between the two visceral and the pericardial layer is obliterated. The etiology of constrictive pericarditis is infectious diseases, radiation to the chest, and sometimes post cardiac surgery patient might have constrictive pericarditis. In constrictive pericarditis, you see two major things. One is intrathoracic and intracardiac dissociation. There is a total deviation from the thoracic structures and the cardiac chamber. Another important thing is exaggerated ventricular dependence. Under normal circumstances, the change in intrathoracic pressure with inspiration and expiration is transmitted to the heart chamber and extrapericardial pulmonary vascular also. Whatever change happens in the intrathoracic pressure is transmitted directly, but mitral inflow gradient remains constant during inspiration as well as expiration. That is very important. Another important thing is with inspiration, your intrathoracic pressure comes down, and with expiration, your intrathoracic pressure goes up. These are all normal physiology. Then what is this dissociation which happens with constrictive pericarditis? The intrathoracic pressure is decreased and it is transmitted to the pericardial. With constrictive pericarditis, this decreased intrathoracic pressure is transmitted to the extrapericardial pulmonary capillary, but since there is restrictive pericarditis, this intrathoracic pressure is not transmitted to, or it limits the transmission to the heart chamber. That is very, very important. But what happens? There is going to be a decreased mitral inflow gradient with inspiration, but with the expiration, the mitral inflow gradient is very much similar to the normal thing. But in inspiration, the gradient is, which was like this, is drastically reduced. And with inspiration, the intrathoracic pressure decreases, and with expiration it increases. That is another important thing which we have to follow. And with inspiration, the intrathoracic pressure decreases further, and in expiration it is increased. Now coming to exaggerated ventricular dependence. What happens with inspiration? There is increased right preload due to increased venous return, the increased tricuspid velocity. There is increased E velocity, which is the rapid filling, which is greater than 40% when compared to expiration, and there is a septal shift towards the left side to accommodate the volume. The increased volume which is coming to right ventricle, by shifting the septum towards the left, this can accommodate the increased volume. This is on the right side of the heart, which happens with inspiration. Now coming to the left side of the heart with inspiration, there is decreased left heart preload. The volume coming to the left side is reduced, and there is decreased mitral inflow. Your peak E velocity is greater than 25% compared to expiration. This is on the inspiratory angle with the right side and left side. What happens with expiration? Your right side preload is decreased and your tricuspid inflow is reduced. There is decreased E velocity greater than 40% when compared to inspiration. Expiration, it is reduced. The right side is reduced, and left side of the heart, there is increased preload. Your mitral flow is increased. There is peak E velocity which is greater than 25% when compared to inspiration, and the septum shifts towards the right to accommodate the increased volume which comes to the left ventricle during expiration. In short, inspiration, there is increased right volume which shifts the septum towards the left, and in expiration there is increased volume on the left side which pushes the septum towards the right. That is very important. And there is increased hepatic vein diastolic flow reversal during expiration and inspiration due to impaired RV filling during expiration. Okay. There is an hepatic vein diastolic flow reversal. That is very important sign for constrictive pericarditis.